sugars. We spoke about what else? What else did we speak about in the last day?
Pressure pulse question. Widen pulse. Pulse deficit. Pulse analysis. Pulse deficit.
We spoke on specific areas because as registered nurses, I told you need to know the apical pulse, which you did. Because the apical pulse is which you listen with your what? The stethoscope. And you listen for what?
30, 66, 1 minute.
No, what are you listening for?
Wait.
And the rhythm. Because that's what you're going to hear. This is the most accurate pulse because that's a direct heartbeat. The radial pulse that you listen to, that you felt, we look for three things, which is the rate, what else? Rhythm, and volume. Now the difference between the apical pulse that you listen to your stethoscope and the radial pulse is called your pulse deficit. And what does pulse deficit indicate? It is a difference. Now what does it indicate? What the pulse deficit indicate? Why you want to be concerned if you have a pulse deficit? Peripheral blood supply, that's what you're looking at. So if you have like 10 beats that is missing, mean that 10 beats did not go down to the periphery. Okay? So your peripheral blood supply will be a concern with a pulse deficit. Then we went to blood pressure, right?
Yep.
And you did what? Systolic?
Systolic.
Over there?
Diastolic.
And then when we do the same thing here with the systolic and the diastolic, we call it what?
Reading.
Now what you also need to understand, that when you do the systolic and the diastolic, we're talking that the systolic is the highest point of pressure exerted on your arteries by the forceful contraction of your ventricles. The highest point of pressure as exerted on the arteries by your ventricles. Not the highest point of pressure on the veins. The veins has nothing to do with your blood pressure. So you have the highest point here with the systolic. What is the diastolic? It's when the heart is in its resting phase. And if you find that a person has such wide pulse, widening pulse, it is a big problem. It's indicative of heart disease. Now you guys did some practice the other day, which you looked at apical pulse, the radial pulse. You didn't have too much on the systolic pulse. But let's continue along here where we now go to, normally when persons talk about blood pressure, the first thing that comes to people's mind is what? Hypertension, right? High blood pressure. And we talk about high blood pressure as being pressure pressure on the arteries that's created by the ventricle. And this pressure that we put on the arteries by the ventricle can be due to things such as lipidemia, right? Facts. Because if the blood vessels like this, and the blood is coming this way, and you have plaques coming up here, it will what?
The force.
Decrease the flow. So to get enough blood to this area, the heart got to do what?
More work.
And that's where your blood pressure goes up. Okay? Yes, Daniel. That's okay, no problem.
Whitening. Magawa.
Thank you. So when the ventricle increases pressure, this is going to go up, systolic. Because this is when the heart
Pumps.
is pumping. So this is going to go up. Now, most times you hear people talk about high blood pressure, and they say the normal is like, what, 120 over what?
80.
80. And anything that goes above 120 for the systolic, you start to get to elevated blood pressure and you start going up, right? 120 to 129, over 80 to 89, and that's sorry, over 80 and then 80 to 89, and then 90. But they said the cutoff will be what? 140 over 90 is when they start considering hypertension or high blood pressure. One of the things that you need to understand though is that you have essential hypertension, right? And essential hypertension is what you know as what? Primary hypertension. And what do we understand by primary hypertension? Come on guys, what do you understand by primary hypertension?
It is caused
Primary
by
hypertension has no underlying disease. It is, not no underlying disease. They don't know what causes. It's what? Idiopathic. Because it can be caused by stress, it can be caused by genetics, right? But they don't know at that time because most persons don't know. So 90 to 96% of persons don't know they have primary or essential hypertension. And normally when you go to the doctor, come and say, oh my God, you have a pressure of 140 over 90. But this can be very erroneous. Persons can experience something called a temporary rise in blood pressure. For instance, persons go to see a nurse, and the mere fact that they walk in to see the nurse to take the blood pressure goes up. Can we call it the white coat blood pressure?
White coat.
Right? White coat, meaning white coat is referred to what? The lab coat, right? So persons right away, the pressure could go up. But they don't have high blood pressure. But you may take it and it's 140 over 90 or 150, but they don't really have high blood pressure because temporary rise in blood pressure can be due to one, anxiety. So when that person goes to see a care provider, they're anxious and the blood pressure can go up. So we want to make those persons feel what? Relax. But you also need to do something else. Do not only ask about the anxious and anxiety situation, but you want to look at what else? Medications that they might be taking.
or the foods to eat.
Or the foods they eat. Or they're
Diets.
in pain.
Maybe they're stressed.
Stressed out.
Yep. Weight, yep.
Obesity? No, we talk about temporary. This is not high blood pressure. Temporary, what can cause it to go up and then come down? Because this temporary, a lot of people do it themselves, and then they say, oh my God, I got high blood pressure.
Sometimes they're upset with the people.
You can be upset and you can get it. Caffeine is a stimulant. You drinking coffee and send it up. If the person said, I just had a puff of cigarette just before we come to take the blood pressure, that can send it up. Because what? The nicotine causes the blood vessels to go to spasm. So when going to spasm, it cuts back on the blood supply, so the whole heart will have to do what? Okay. So you want to ask person before you take your blood pressure what you were doing before you come to the blood pressure. Okay? If the person uses a lot of salt, and very salty breakfast, it's going to go up.
Cause it.
It's going to go up. But what I want you guys to take note of, and stay with me in this. We know high blood pressure, right? We know that they have the three types: essential, they have a secondary, that is due to what?
Underlying
causes. When you know what's going on, and at that time the person is put on what?
medication or
And we talked about we have also here back on three types of medications, which was the beta blockers, the calcium channel blockers, and the inhibitors. And you know that the beta blockers were into what? Beta blocker 1 and beta blocker 2. Actually, I have 3 2, but the focus on beta blocker 1. Beta blocker 1 works on where? Where it works on where? Listen to the question.
In your heart.
Heart.
On your heart.
Beta blocker 2 is on the lungs. And ATA is talking about what? The one that's happening to the heart. That affects the heart. Whereas A1 affects your lungs. And that's why they talk, affecting the lungs. You got to be careful giving beta blockers to persons who have what? Asthma. Asthma. And we see a question come up when we talk about beta blockers and asthma. You're right away, asthma is in the beta blockers in the number 5. Okay? Also, because a lot of persons, especially men, hear that high blood pressure medications is causing them to become or to have erectile dysfunction, they don't want to take blood pressure medication. But the blood pressure medication that causes a problem is the beta blockers, not the ACE inhibitors or not the calcium channel blockers. But they're hearing that blood pressure medication will cause them to have erectile dysfunction. But they don't know that it's not all blood pressure medication. The common man out there will take all blood pressure medication. So that's what patient teaching common is when you're going to talk. Is when you tell the patient that beta blockers are the ones that you need to be. And most, I think, providers will tell the patient, I'm going to put you on X and Y or what have you, so you don't have that erectile dysfunction. Alright? And the other ones you said is what? Calcium channel blockers. And an example of calcium channel blockers what? Which medication you have on the calcium channel blockers? Come on guys.
What medication you have?
Anything that ends in right? All that creams. And for the ACE inhibitors, you're going to go over there. Say like what? PRIL at the end, RIL, that's what you're going with, okay? And right away you know that medication is ACE inhibitor. Alright? You ask the question. Alright. Now, most times you talk to people, they know you're talking about high blood pressure, right? And some people will talk to you about they use certain what? Home remedy, such as what? Tea, water, cucumber, and you know all kind of stuff. But what you gotta know is that once a patient is put on antihypertensive medication, they're not supposed to stop it. And people stops it. People will decide that, oh, my friend told me that if I drink this every day, I got no problem. You got a big problem. Because the complications of high blood pressure is the kidneys. You're going to end up on dialysis. You get a stroke. You get a heart attack. That's what high blood pressure is. And unfortunately, it seems to affect black people more than anybody else. They're not different. And then we talk about all the things you gotta watch it what? The diet, you gotta watch it for size,
Exercise.
watch what you drink, watch what you smoke. All of those are what? Hyper,
Risks.
cancer,
Risk factors.
reducers, right? So we don't want those things to happen. But guess what? We can talk about high blood pressure all the time, but something that some people don't really talk about is hypertension. So what is hypertension?
Low blood pressure.
So how do you get hypertension? How do you get hypertension?
Normal, when you drink
Number for what? That's low blood pressure. There's my shorts. My shorts drink. So is this you guys looking at all the time? This is something is my shorts. My shorts drink. Go ahead. Yes. What else is with the hypertension? Come on guys, please.
Dehydration.
Dehydration. So why is dehydration a problem? Remember I also asked the question why?
Because you don't drink it.
So why? Why dehydration is a problem?
Dehydration causes a low volume of fluid in the
That is it.
body.
Decrease blood volume. And anything that will decrease blood volume is going to bring your
Blood pressure down.
So you have dehydration. What can cause dehydration?
Diarrhea.
Vomiting.
Heat.
Blood loss. Perspiring.
Perspiring.
Exercising. People go and exercise.
Right.
They can get hypotension.
Tension.
But we have different types of hypertension, right? We
Primary.
have something called hypertension, not hyper.
Okay.
You have orthostatic hypertension. Orthostatic hypertension, also known as postural hypertension. Postural hypertension and or sorry, the same thing. Postural, P-O-S-T-U-R-A-L. Orthostatic, O-R-T-H-O-S-T-A-T-I-C. Orthostatic hypotension. When you put it in there, it's the same thing. Postural and orthostatic is the same thing. You will see, it will also tell you orthostatic hypertension. But as you read, it's going to drop you down into orthostatic hypotension. And I will explain it to you. You as a nurse, the registered nurse, you have to make that decision of what you need to do for the patient who is hypotensive. So, if the pressure is going down, you gotta find a way of what? Get it up, right? And just now we talk about the blood, the volume deficit, and all that sort of stuff. But people who are on what? Anti-hypertensive medications
Can have
are
hypertension.
very high risk. Because they take the medication, they drop their
Blood pressure.
so you gotta watch it how they're taking their medications, how they're reacting to the medications. You also wanna be
Check their blood pressure.
looking at not only what they're drinking, but you want to look at if these persons are persons who go to the gym a lot. You perspire.
I see.
You know, people say if you don't perspire, you work out. But that perspiration, you're losing fluid, and that there can put you into hypertension. Sometimes you see some guys just work out, and then you see all of a sudden and they fall down, right?
Weak.
They're not weak.
What happened?
It's their hypertension, it went down,
Postural.
right? So with the orthostatic, we normally check the patient's blood pressure in three positions. We check it in the what? The supine, the sitting, and the standing. Now normally you know that when you tell a patient to sit on the side of the bed, before standing, you want them to acclimate to the new position, because if they stand up immediately, gravitational pull is going to cause them to fall. No gravitational pull, right? So you want to look at that. But patients who stand up, and instead of the patient, the blood pressure going down, the pressure can go up.
Shoot up.
And that one, when it goes up when they stand, that is orthostatic hypertension. Stay with me, guys. When you look it up just now, you saw orthostatic / postural hypotension. You can get it in lying, sitting, or standing on the floor. But when you get orthostatic hypertension, is when the person moves from a sitting position to a standing position, and you find that there is an increase in the systolic of more than 20 mm. If when the person was sitting, and you took the blood pressure was 118/70, and then when you ask him to stand, and you check the blood pressure, and it went up to 138/70, it means that the person has orthostatic hypertension, not orthostatic hypotension. You guys with me? Hypertension is when the person blood pressure drops. Orthostatic is when they stand, not sitting, but when they stand, the blood pressure drops. Orthostatic. So please remember the difference. So when you're checking it, you will know what is the difference. So, if a person has hypotension, what do you think you need to do?
Is that hypo or hyper?
Hypo. Or is it the left?
Some water, yeah, give him some water. Give him some water.
Give fluids, what
That's a
else?
good one. Or some cases you might have to give IV fluid, which is same thing as fluids. Same thing as fluids.
Okay, IV fluids, but that comes in a doctor's orders. But what you can do, think of what you can do as a nurse. Before you go, salt. Remember, you don't give salt to people who have high blood pressure? Because pressure will go up. So the pressure's low,
So you give
you
them
want the pressure to go up.
Salt.
So you give them
So you can give them something salty too.
Please.
Alright, and this will help to, in fact, if you look up to see what you can do, actions to take for hypertensive, you're going to see the top, one of the very first thing is to use salt. Sounds weird, right?
Yes.
Use salt to raise blood pressure. We use what? Caffeine to raise the blood pressure. Drink some coffee.
Yes.
Definitely will do it.
Do it.
You don't want them to smoke, but smoking will do it. Then you want them to smoke, right?
No.
But smoking will do it. All those things can cause a rise in the blood pressure. Now, what you need to know, is those differences we talked about? Systolic, diastolic, all will happen. So you're going to just take out your stethoscope and your what? Your sphygmanometers. And you're going to do 2 persons. So let's start these.
Okay.
In fact, what I'd like to see you do is do it like if you have complete examine your patient. You go to the heart, do the apical, the radial, the orthostatic, whether it is sitting and standing but no line because you haven't where to lie. So, when you're doing it, please remember that try to put the stethoscope on what? On skin. Don't try to put the stethoscope on top of the
Dress.
shoulder. When you put on the cuff, do not put the cuff over clothing. Alright? What I can tell you is that, strange enough, in today's world, you know, you go and they put you attached to what? You got a child in vital sign station, and it does your what? Pulse, blood pressure, O2, you just name it. You ask a lot of theories, I won't say nurses, because as nurses you're supposed to be able to remember to do that. Right? You have a difficulty. So what's going to happen? For everybody, I want to see where you place the stethoscope. I want to see how you put on the apparatus. No. See that you're doing the apical, the radial, and the orthostatic. I want to see placements for all. The guys, please clear off. Remember, for the apical and radial for the pulse deficit, you have to have 2 and 1, right? Guys?
Oh, that's right.
2 and 1.
Okay.
So please
Begin.
start. Let's make a list. Make a comparison.
So what's yellow is there, so you got me?
You seem like you was busy.
So?
Please forgive me. I will change.
Please wash your hands or use the hand sanitizer.
Pull your dress down so I can see some skin. Alright. So when you're ready, just hit start, okay?
Okay, I'll tell you.
This is the right position?
The second, and here goes. Is that the second one?
Please ensure you clean your stethoscope for every person that you're going to. And that all you clean the stethoscope before you write differences with the different types, be it because be whatever. See if you can make out the differences and what it means to you when you do it.
You have an active pressure. 81 in 1 minute? Wow.
I know, I used to be like 60 when I used to work out.
Alright, so that's 81 for your epidural. Write it down.
Epical first. Epical.
Around 81 epical. Okay. So now I'm gonna check your radio. Actually, I should check your carotid first.
Guys, you see there's these marks on these cups? There's a reason for these marks. Please ensure you're using your arm and you're letting these marks indicate the anticubital area. That's all right. There's a reason for doing that. Good. How do you know? Guys, listen up please. How do you know when to place the stethoscope on the arm?
When you feel the beat,
When you do the blood pressure, how do you know when to put
when
it?
you feel the pulse,
When you feel the pulse? Radial pulse. And when you feel the radial pulse, what happens?
you place it on the pulse.
No. What is your radial pulse has to do with? How do you know? Listen to me very carefully. You have the stethoscope. You're going to be listening to right? You're going to be listening for the first and the last beat. Question. When do you know? So listen. When do you apply this stethoscope to listen? When? How do you come up with the idea that you're going to just...
When you have the specific beat, when you inflate.
How far should you inflate?
200.
It's supposed to be the averages and then you go up a little more just in case. Some people may know that.
Guys, just listen and listen up carefully. Remember just now we talked about the apical and the radial pulse. The radial pulse is found out there in line with your You find the radial pulse. You apply pressure and inflate the cuff and you keep feeling the radial pulse. And when the radial pulse, you don't feel it any longer, you squeeze one more squeeze. Will go up. Now you put the stethoscope, to the antecubital area. Right? Because you don't know, a person will have 220, 230, 240. So you say 200, this is not right. Okay? So you need to check your radial pulse, because remember the radial pulse is a reflection of your heartbeat. And you keep inflating, and you inflate, and you inflate, and you just keep feeling. As you inflate, you feel. And then when you don't feel it anymore, you give it one more inflation so that then you listen. Practice that first and see if you can get that. And that's the real way, the true way to check your pressure.
Can I practice?
It's not strong, bro.
Just takes a little bit.
I don't feel like I'm joking. Unless you're okay with it. Try again. I feel something, but I'm not sure. You know what I'm saying? Yeah, hold on, go back to the light is starting.
Try to do all the different pulses that you want in practice. So you have the apical pulse, you have the carotid, and you have the what? Radial. Then you have your BP. Lactic midline. Go midline. Go midline. This is your midline. This is your sternal clavicula muscle right here. So it's going to drop in between here. So when you come, this is our catheter here. You'll come down. Right here. Go right inside here.
Right inside.
Just don't talk to throw me off.
Yeah, feel it.
And remember when you do now the apical pulse, it's what? Middle, clavicular, and feel. 1, 2, 3, 4, 5. Then put it on top there. And do remember that if it's a pediatric, you do not do 5 intercostal spaces. For pediatrics, it is 4 intercostal space. You guys hear what I'm saying? For adults, it's 5. For pediatrics, that is children, it's only 4. Okay?
I was listening.
That's your carotid.
Yeah,
68. Carotid. Alright. Check that radio. Wait.
I feel it. I need a lot of practice to get this thing as Now we're gonna do this, right? This is supposed to be.
Hey, what was that again? No, that's when we do the,
Not to the John Cruise.
el teléfono de los números.
I'll check your blood pressure.
Wi-Fi, ¿no?
Okay, let me make sure. That's what the busy on that side.
Right here.
That's your stuff?
My stuff.
That's your stuff?
I was like, should I take it to that?
Okay.
I don't think we're gonna use that shit.
And then I have this.
I don't even know where it is, so I can't even find it.
We have this here. Like this. So now I'm going right to tight to left to loose. Let me see if I can do that. Right tight, left to loose. We have to go like this. So we wait, how do I so I will put some of that here.
84?
See, that's why I clicked it. See?
$130.
125, right?
Yeah.
I'm the same bed about 120 with 84.
Wait, isn't it only on the even numbers? It's even numbers only, right? Yeah.
It's the lines in between.
Yeah, never mind.
The wide little pause that
Last one? That's right.
When you feel the
I should sit and examine me. My doctor said to examine me.
Attends, il m'a mis ça gros mot.
Okay. I'll move. This is the clavicle, right?
Yeah, and then he said,
And it's in the middle.
I got it. I definitely had it.
Clavicle? Good for you right here.
We show the arrows pointing right here. Right arm in the middle, left arm in the middle. Where the arrow points. That's where you're going to put this. That's it. Right. Alright guys, you're not experimenting your own. Ask the person to just bounce for about 30 seconds, and then you do the blood pressure and the pulse.
Your blood pressure is standing up.
To see what is the effect.
Yeah. And your blood pressure is standing up. Bounce up and down for 1
Right,
minute.
so ask the person to, like if you're exercising,
Let's make a TikTok.
don't jump straight towards the wrist, but do movement. Let's take the blood pressure all the way. So we can see what is the temporary rise in blood pressure. Okay? You want to see what is the temporary rise in blood pressure that's false.
How come you go healing today? Healing never come. Forgive you. I'm here. You have this is not nice. You just even I can't let you. You always save my chicken. You always save my chicken. I'm looking for a patient to do. Will I have you? You want to have me? Yeah. I'm doing it after.
I think standing should have, because a lot of this stuff you give us is small, not even medium. We should give just a large and a medium. Give everybody small, and those are the pediatric. Okay.
How much you pay? 125 or 80.
Guys, please remember, I want you to do temporary rising blood pressure. Alright, do something. The hands, if you do anything that will cause physical exercise, and then you take it immediately. So you can see what's a temporary rise in blood pressure. The difference between when the person is sitting and exercising is sitting there that is struggling.
Tight, I think it could be a little bit tight. Yes. You know what, go ahead. Go right on the here.
I gotta do some shakes. I gotta do some shakes. Hey, manual.
I prefer it.
Tight, no, the wrong way. You have to hold it. Just make sure you hold it.
$145 if you anything. Everything. I gotta watch what I eat. I gotta eat more seafood. I eat too much red meat. Walk?
Fast.
Did you check here?
It was 130 something. You're too fast. You gotta go too fast. Definitely slowly.
That's it, right?
You know if you sit my shirt off, you know?
Start again.
I don't start that though. All the guys start taking their shirt off and shit.
Leave it here, yeah.
Guys, don't forget to do the temporary. I want you to compare the regular sitting with a temporary rise, so you can understand how temporary rise can get false reading.
Let it out slowly.
Okay, move something. Do it.
Slow.
Try to go to the doctor. Nothing but bad news.
Tight.
So now gotta just a workout, gotta I just did push-ups. I just did push-ups. Give me some hand sanitizer.
Try not to put your hands on the ball unless you turn, because some persons don't twist it. And the sun is towards the ball and not the dice ball. And when you put your finger on your thumb on top of the ball, you will hit the Looking at stuff.
Oh my goodness! Let me check yours. Don't go this up. Let me check yours. We didn't work out. We didn't do any of that. You just all you do is to do it and then I check yours. No. Oh, me too. I came for a piece of paper. Once I get a piece of paper, I'm done. I'm not doing that's wasting my money. Hopefully I'll come into some money, I'll come, I don't know. There you go. Hallelujah. I accept it. Do some jumping jacks. Yeah, come on, let's do some jumping jacks. Come on, let's do some jumping jacks. Gotta make yourself inspired. Got the jumping jacks. 1, 2. Come on, Jeremy. Ladies, Jeremy. 1. You gotta sit down. Ready? Stop on. Okay. Two over 90. It was much higher.
I want to do both sitting. One sitting, normal, then exercise. So we see you
He's getting a lot of practice.
The temporary, see what it's like?
Yeah, man, I want to see the first.
I might just take by the time he's done.
That's picture abuse, right?
Okay, I like it. I kind of like it.
You can drink some tea.
So you can't find it?
Eat some with salt. Coffee or you eat something salty. Yeah, to bring it down.
Oh, just got it.
Okay, you want to start?
Yeah, don't talk, please. Go start.
You know which one I like?
Brenda, what's that one? Não, chega. Me conta aí quando eu vou. Né, tá lá.
Seventy. Right. Now let me check your radio.
Can I take your phone?
I gotta cancel my
When we do the blood pressure, right? If we do it here, will it be accurate?
No, when you sit in here, you're gonna say the feet's supposed to be. No, but this
Yeah, you check if you feel, when you feel it, then check here, you feel the pulse. If you feel the pulse, you start to pumping. Then when the pulse stop here, you put this here and
So the first thing I do is check I get thinking about now you inflate until you don't feel anything there. So I have to keep my hand.
Difficult.
Because you don't need this.
I'm gonna get blood pressure now.
This is tight.
Okay, now when
I'll do something nice.
Wait, he did mine, right?
okay, no. Okay, now you can use this.
So now, you have way too much clothes on there.
Now you can
I know for a fact that I'll get a better reading with less clothing on. I'm just saying.
First time I hear 120. The first one I hear is 120. Because you hear, first time when I hear it is 120. Okay. And then the second one is 75.
So now you get it.
So I got to get it.
Yeah, you feel the pulse here, you will inflate until you don't feel any pain. So now you do this.
This one.
And then slowly deflate it.
C'est le web qui pousse la révolution doucement.
100 over 79.
Alright guys, this is just look on top of the board.
Thank you, sir.
I'm going to look at an animated video.
Do me a favor real quick. Lift your shirt. No, I said lift your shirt. There you go. Thank you. Alcohol, please. Shit is dry.
Alright guys, this toilet line behind this room.
Slow.
Instead, gravity pulls blood down away from it, causing arterial pressure to drop. Ordinarily, this drop is transient, lasting only 2 or 3
Let me go over back again, guys, stay focused.
stands up after having been seated or lying down.
Alright, let me start over.
Orthostatic hypotension, also known as postural hypertension, refers to an atypical drop in blood pressure.
Typical means it's not normal.
After having been seated or lying down. When standing, gravity pulls blood down away from the brain, causing arterial pressure to drop. Ordinarily, this drop is transient, lasting only 2 or 3 cardiac cycles. If an individual lacks the necessary circulatory resources or blood volume, lesser amounts of blood will reach the brain. This is manifested as dizziness and syncope, and increases the patient's risk of
Alright, you see what it says there? Ineffective reflexes or low blood volume. This causes less oxygen to go to the brain. And this results in dizziness.
Dizziness.
Syncope is similar to fainting, right? And it increases your risk for falls and what have you.
falls. The baroreceptor reflex normally kicks in to compensate for standing. Baroreceptor is located in the vessels of the chest and carotid, sense a decrease in blood pressure that will lead to an increase in vasoconstriction and an increase in heart rate to bring blood pressure back up.
So what causes the heart rate to go up? What causes your heart rate to go up? Vasoconstriction. All right? Once the blood vessels constrict, remember I showed you guys earlier on? In constriction, they have the plaques, the heart got to do what?
More force.
So that's going to increase
Blood pressure.
In the longer term, levels of epinephrine and antidiuretic hormone increase in the blood to also help maintain blood pressure while standing. There are varying causes.
All right. You know when you get you have an allergic reaction?
Yeah.
And you use what? EpiPen?
Yeah.
And what EpiPen has in it?
Epinephrine.
Okay? Increase your heart rate.
Hypovolemia or reduced volume in the vascular compartment is one of them. Blood pressure may be sufficient when a person is sitting or lying down, and when they stand up, they get lightheaded. Some common causes for hypovolemia may include inadequate fluid intake, excessive urination, use of diuretics, excessive sweating, loss of fluids from vomiting or diarrhea, and loss of fluid that occurs from prolonged bed rest. Heart conditions such as heart attack, heart failure, and bradycardia also decrease the cardiac output that is necessary to overcome the flow of blood away from the brain when standing up.
I just want to stop here. Just one thing I want to indicate to persons. You see where it's a loss of fluids from?
Diarrhea, prolonged bed rest.
People who are lying on bed rest all the time is at high risk for hypovolemia. And I know in certain cultures, we like to sleep, right? We like to lie down all the time.
Oh, yes.
But especially so when you're in a nursing home, some patients don't want to get out of bed. And you have some patients who, in fact, in nursing homes, you should not have patients having bed bound. Nobody should be bed bound because of things like this. Nobody ever think about the prolonged bed rest.
The prolonged bed rest, how does that exactly lead to the hypovolemia? I'm trying to figure that out.
Think about when you are lying in the supine position. Go back to when you're doing the orthostatic. Supine, sit up, it increases.
Right.
Standing, it increases. Lying, it is not. And you may have been taking less food because what? You're lying, you're not drinking anything. Okay? So if you're in that position, you're not drinking anything, and then you're in the supine position, it's going to create increased stress on your system. Okay?
Thank
A
you.
lot of people do not go with the prolonged bed rest. People seem to think that prolonged bed is a good thing. It's not a good thing. How long should you be in bed for?
6 hours.
8 hours. It says 7 to 8 hours, but you find that a lot of times persons will say, I worked so hard last night, but I got sleep for the whole day. That's no good. And the body get accustomed to that. Don't let your body get accustomed. Do whatever Mother Nature tells you. Everything that goes on in your body, much in Mother Nature warns you. If you, for instance, you're going to have a heart attack, it gives you what?
Pain.
Chest pain, right? You got a problem with stress or something, it gives you
Headache.
headache. Mother Nature warns you all the time. And if you listen to Mother Nature, trust me, a lot of things is not going to happen to us. Okay? Now look at the two vessels. You know what's the lumen of a vessel, right?
Lumen.
You know the word lumen?
The inner part, right?
The inner aspect of the vessel is called the lumen. And if you look at the lumen over here,
It's nice and
nice
loose.
and big and broad, look over there.
It's very narrow. Yeah, it's closed up.
Right? This here can be due, and in this case, I will not say due to vasoconstriction because the blood vessel will come.
I don't know.
I said that's more like deposit, but
Yeah.
I guess they put this for vasoconstriction. All right?
Endocrine issues like hypothyroidism or low levels of cortisol, such as with Addison's disease, can lower blood volume and blood pressure, putting a patient at risk for postural hypertension.
Where we get, what organ is responsible for the Addison's?
Adrenal.
Adrenal gland. But then look at what is hypothyroidism.
Thyroid gland.
Regular thyroid, thyroxine. Remember you did aldosterone? And remember you did angiotensin 1 and angiotensin 2 and the effect it has on fluid nitrates and the blood pressure? Okay, you gotta put it together, guys.
Diabetes can damage neurons, reporting the negative feedback loop for increasing blood pressure and acidity. Many medications have the side effect of postural hypertension and increase the risk for patient falls. Meds used for hypertension and angina fall into this category, including alpha blockers, nitrates, ACE inhibitors, ARBs, calcium channel blockers, and beta blockers. Other drugs that may cause orthostatic hypotension include drugs used for erectile dysfunction, like sildenafil, sedative or anti-anxiety drugs like benzodiazepines, hypnotic drugs like zolpidem or diphenhydramine, muscle relaxers such as cyclobenzaprine, tricyclic antidepressants or TCAs used for depression and ear pain, dopaminergic agents used for Parkinson's disease such as levodopa, both atypical and typical antipsychotics, anticholinergics like oxybutynin, opiates like morphine, and cardiac glycoside digoxin used for heart failure or atrial fibrillation.
All right. We talk about somewhat, at least 3 of those we talk about up there, right? Looking at the nitrates or ditryl trinitrates according to the sublingual, right? But I want you to pay attention to what's on the right side. Medications that is used for erectile dysfunction. Now earlier we talked about giving the beta blockers can be a problem. But think about it. You're not giving the beta blockers, but you're giving the person something to have what? To have an erection, right? And that can cause a person now to drop
Blood pressure.
their blood pressure.
That's true.
Drop going to the head. So some persons may use it, and next thing you know, they faint. Or have syncope. Right, because the blood is being utilized in where? To
In the
get
penis.
erect because you need a blood supply. But one other area I want you to look at very carefully. There's a lot of people go on what? Antidepressants, tricyclic antidepressants. Always, from since I was a nurse many years ago, we always knew that persons who are on antidepressants are very much at high risk for falls, right? Because of this hypotension.
So how does that work on the body for it to be,
Risk for fall.
hypotension?
Tricyclic, it works on the brain, it works on just like how we have the dopamine agents, the levodopa, right? It's all dealing with the hormones and dropping the supply. And when you don't have it, for instance, or let me give you an example. Let me get something you know, like epinephrine. You know epinephrine, right? And we know that with epinephrine, if you give epinephrine, it's going to cause what?
It's going to increase the heart rate.
How? No, it causes constriction. So some other medications can cause what? Dilation. And when it causes dilation, it what? Increases blood flow, and you can lower the blood pressure. You guys with me? All right. Now, there's a typical and atypical antipsychotics. We know that antipsychotics are things such as your what? Your Meloril, your Stelzines, your Haldol, all those type of medications. Those are all chlorpromazines. They're all medications that's used for psychotic patients. Remember, psychotic patients are patients who are not in touch with reality. But these medications can cause these patients to do what? Of hypotension, but they can have them do what? What else? We talk about these antipsychotics. What did we say can cause? That like to kill me. What else do we say when a person using long-term use of antipsychotics? What's that?
Parkinsonian symptoms. They can develop.
Those are just too broad.
They can develop Parkinsonian symptoms.
You can get Parkinsonism-like effect, but the one I was looking for specifically is your EPS,
Extrapyramidal symptoms.
pyramidal,
Extrapyramidal symptoms.
right? That's the one where you have the pill rolling, when they're walking, the shaking, and that is due to the same
Long-term use.
antipsychotics, and that's when the doctor's going to put them on something to counter, which is what?
Congenital.
Okay? All right. Now look at oxybutynin. That's used for pain, right? Same thing goes with morphine. Well, we just talked about digoxin, when we did digoxin when we tested for the apical, right? And it's treat heart failure. So, see how many things are involved that can cause hypo, not hyper. Right? Now for raise and prioritize. When you have a question and they're prioritizing, one of the first thing they're going with is what? Patients who are on, see the highlighted? Number one,
Angina medications.
right?
Hypertension.
Hypertension is angina. What is angina? Angina is such a very problem for the blood supply to the heart. The coronary arteries being what?
Constricted. Constricted.
Partially blocked. Right? Remember, you have two types of anginas. You have stable and unstable angina. And we discussed them both. And then we can lead on to your myocardial infarction. Their medications,
Heart attack.
like for instance the sublingual or what have you, they're going to be used to dilate.
Loosen. Dilates.
Hypertension medications, some of them are used to dilate and block the movement of calcium into the
Channel
muscles
blocker.
to prevent the contractions. Again, I also ask the question why.
Why?
Why?
Yeah, why?
So you can understand the rationale why things happen. Okay? But I just want you to don't just look at these like that as you look at the video. But when you look at the video, stop it and go through them, like sedative, anti-anxiety medication, like the benzodiazepines, right?
Mr. Webb, I can't remember. Anti-cholinergic, that dries you up?
Dries you up, yes.
What did she say?
Anti-cholinergics. It
Dry.
can cause you to get dry, decreasing secretions.
Okay.
Okay.
Look over there.
All right, let's go on.
Alcohol, the most commonly used CNS depressant, also increases the risk for orthostatic hypotension. Since
Alcohol. You know what you guys said just now, alcohol, right? Now let's hear why alcohol.
it causes vasodilation.
Causes what?
Vasodilation.
Those other stuff
Hypertension
causes
becomes more of a problem with increasing age. This is due to decreased activity of compensatory mechanisms like the baroreceptor reflex. Elderly persons also have reduced blood volume and reduced skeletal pump function, which further complicates the problem. After age 70, patients are more likely to experience postural hypotension due to the aging process, and this is the most often systolic dysfunction, which causes a decrease in blood flow to the brain.
Remember when you stand up, this here, the baroreceptor reflex, which is a compensatory mechanism that will, after a couple of beats, will adjust to ensure that your head don't get what? Light, enough what? But when you lie down all the time, that don't come into play.
Right.
Okay? So that's, lying in all the time, and there's, some people lie down, they have a nice long sleep, and when they get up, you ever see a person sleep for long, when they get up, they're like,
Yeah, the dizzy.
not only dizzy, like they lose their balance.
Losing the balance.
Right?
What about when you I'm sorry, continue.
No, go ahead.
What about when because sometimes this happens to me sometimes when I'm sitting in one place for too long, when my hand gets like sleepy or my leg gets like sleepy and
That more likely is due to that, possibly you're just sitting in an area that is pressing against the blood supply, and that's responsible for that. You know, good way to know this is that, for instance, when you're sleeping, and you sleep on your hand, you get up, you see your hand fall asleep.
Fall asleep,
There's
yeah.
nothing going on.
But there's
Just
no blood
more
that go
pressure.
through it.
Now think of this, and think of a person getting stage 1 through 4 pressure ulcers. The same effect you got here, the person who's sitting, they're getting that.
No blood supply.
So no blood supply, so now what's going to happen? The tissue will start to break down. All right, same concept. All right, reduce blood from systolic function, let's continue.
Elderly patients also are more prone to be taking antihypertensive medications or diuretics, which further compounds the problem. In addition to dizziness, patients may experience weakness and ataxia, which may include abnormalities in gait and speech. It's important to treat and prevent orthostatic hypotension, especially in the elderly, because fluctuations in blood pressure to the brain increases the risk for stroke and complications from cardiovascular disease, like angina, heart failure, and arrhythmias.
All right. What did he just say that ring a bell to you? What did he talk about? Increase the risk for what?
Alzheimer,
Stroke,
stroke, arrhythmias.
heart conditions. Remember that man that was choked by the police?
Yeah.
Right? Remember his daughter who was only 25? She died from a stroke that's related to her heart. Right? So when you have heart conditions, it increases your risk of getting stroke. Because a lot of people think that most of your stroke can be due to rupture of the blood vessels. But it's not only rupture of the blood vessel. It can go, a lot of them is happening because you get clots. Clots go into the brain. Right? And those are, most of them are caused by clots. Most of these strokes that people get.
Can any of this condition lead to nasal bleeding?
Any what?
Can it lead to
Can it cause epistaxis?
epistaxis? Thank you.
Hypertension kind.
Hyper?
Hypertension.
Okay.
Not really hypo,
Okay.
but hypertension kind.
Okay.
All right, and a lot of times that people who bleed from their nose, they pick in the nose. Not that it just spontaneous bleed. They have people who get this, but some person where they got the thing in the nose, and over a period of time, it's just like if you keep rubbing on the wall, that wall will get what? Tin. And if you get tin, what's going to happen? It's going to expose blood vessels, so it will become very easy for the blood vessels to get broken, and you're going to get bleeding.
I had a friend like that, and I was afraid it had something to do with the brain or something, like a brain rupture or something.
No.
Because
If a brain rupture, guys, what do you think will happen if a person have a rupture in the brain? Think deeper than critical thinking. What do you think will happen if you got a rupture of a blood vessel in the brain?
You're gonna bleed to your brain. You're gonna bleed.
stroke,
You're gonna bleed to your
You're gonna have
bleeding.
but what a bleeding is gonna cause?
Stroke.
Bulging in your head, maybe.
Bulging in the head? No, not aneurysm. What's gonna cause ICP?
increase blood pressure.
Because why? It ain't going nowhere. It has nowhere to go. Boston, here.
Here.
So it's gonna start depressing the brain and cause a lot of problems. That's why when we talk about the different layers of the brain, remember we talked about subdural hemorrhage,
Yeah.
right? Remember? Pia
Mita.
Then you have there arachnoid, and then at the top you have there.
Dura.
Now think of it, subdural or subarachnoid hematoma. It means below these different layers. Okay?
Having healthy skeletal muscle pumps helps blood return to the heart to increase preload. to help prevent orthostatic hypotension. Being immobile and confined to a bed brings about changes that beget postural hypotension. And mobile patients have reduced plasma volume and decreased muscle tone in skeletal muscle pumps.
That's what you were asking
which
just now?
decrease blood return to the heart.
No, that's what you were talking about. You're gonna tell you what person's lying,
The decrease
and
in
if you don't
plasma
have
volume
to,
is observed.
Oh, yeah, that's right. That's true.
Of being on bed rest. The decrease in activity of skeletal muscle pumps usually takes about 2 weeks of being on bed rest.
so if you develop over a period of time,
Peripheral neuropathy.
just lying in bed, when you get older, remember we teach our body what we want it to do. So when we get older,
We continue
it's
doing
very
that.
hard for us to be aroused to get up. We're all leaving like, you ever seen the patients in the nursing home? Some of them are like, leave me alone. Don't get me up, leave me alone. Why is others? They get up early, they step, they're ready to move and do stuff. And while some others who are younger than them, it's like, leave me alone, please. So, this is a reason why.
Okay. I'm gonna stop you a bit too much.
Diabetes mellitus, spinal cord injury, and cerebral vascular accidents, such as a stroke.
This makes more
Impair
sense.
autonomic nervous system reflexes, necessary to maintain blood pressure upon standing. In neurodegenerative conditions, such as Lewy body dementia, amyloidosis, Parkinson's disease, and Shy-Drager syndrome, autonomic nervous system neurons may fail, bringing about orthostatic hypotension.
Just on this here, you see dementia there, the Lewy body dementia? A lot of persons who have dementia, it's not just about the aging process. The persons with hypertension, a complication, is vascular dementia, right? Vascular, the blood cells. And if you have those blood cells being damaged in the brain, you're going to end up with dementia. And you know dementia, we noted by short-term memory problems and continue to lose memory. And this is progressive, it just keeps getting worse. Vascular dementia, all right?
If you-
Hypertension,
And what if you have a
hypertension
tumor?
causes it.
What if you have a tumor? A tumor in the brain?
And what
Would that,
do you mean?
would you?
Cause
have,
dementia?
Dementia from that?
The tumor is going to cause mental status changes, meaning cognitive changes, how you're going to be, when they remove the tumor, pretty good. Remember when we talk about the patient who had the one in her brain, and she was forgetting things, she didn't know what she was talking about and all that kind of stuff, and then when they remove it, when they should not have done surgery, because it was a tapeworm, and they could have given her the medicine to kill it. But when they saw it, they thought it was a tumor, and that's right here in New York, one of your fancy hospitals. They went in and removed it. And when they removed it, she came back to normal. Right? But while the tumor was there, she couldn't remember anything. She didn't know what year, what month, all these things was a problem. Okay? But when you're having vascular dementia, it's when you're having changes that is happening to your blood vessels due to the high blood pressure complication of hypertension.
So if you address that complication, then the dementia symptoms will be eliminated. Yes?
I would not say it's going to be eliminated. It's going to slow down.
Okay.
Because with dementia, remember,
It's progressive.
when persons get dementia, you put them where? Depends if it's severe dementia, you're put in a lock unit, right? And when a person gets dementia, it starts keep getting worse and worse and worse. Remember, the first thing you see is what? People might forget that 12. Remember we talked about the food? Mother cooking food and all of a sudden the food getting salt because you forgot you put it in? But then what? It starts getting worse. But when you live with somebody, you don't really see it. You accept it as a part of the normal. But somebody who just visits once in a while, they will pick on it right away. And say, something's wrong, your mother, she's not too...
Because I know somebody like that, right? Oh, no, not this particular situation, but dementia in general. and I was advising that person to they're much older, so I was advising them to read more.
Right. They're saying if you engage your brain, it slows down the progress.
Okay.
Not that it eliminates it, it slows down the progress. So you get persons who do a lot of crosswords. That sort of stuff. It's good. People who read all the time. You find, and if you check it out, persons that you know, people who read it all the time, you find that these persons are what?
Sharp.
Pretty sharp. Yeah. It's the persons who are like more like looking to video, looking the movie, not causing the brain really to
Or
The connections.
So the working of the brain, because you're being fed. You're being fed all the time. But when you read something, if I read about a boat, right? What happens?
You feel like you're
If you read
there.
about a boat, what will happen?
It widens your imagination.
You got to visualize what a boat looks like.
That's right.
Based on what a person has written, person might say this is a big boat, a big blue boat. So in your mind you're doing what?
Thinking about a big blue
Right,
boat.
you visualize it in your mind. But when you sit down to look at the visual, you're seeing it. It's not causing your brain to do no work. That's why they say individual, okay? All right, let's move on.
One more thing. What's the
Diagnosed orthostatic hypotension. It is important to obtain a thorough medical history. This includes history of syncope and falls, medication history, and history of medical conditions. Blood pressure is measured while the patient is supine, sitting, and standing. Symptoms while in these different positions will be noted. Diagnostic criteria for orthostatic hypotension is a decrease in systolic pressure of at least 20 millimeters of mercury, or a decrease in diastolic pressure of at least 10 millimeters of mercury during the first 3 minutes of standing. A tilt table can be used to safely move the patient from recumbent to standing positions and vice versa. Blood testing for hypoglycemia and anemia may be performed. An EKG or echocardiogram may be performed to test for cardiac arrhythmias and for structural changes in the heart, such as from valvular disease. These tests.
All right. Remember when we were talking about the apical and we were looking at the different, we did your 4 valves, right? And we said those valves is related to the beats, right?
Right.
And then we know that you have your there. Your first wave will be what? The P.
P wave.
P wave. And the one that you see goes up there?
QR complex.
QR. And then you have your ST. Okay? Now, once you know your electrical conduction system, you know your sino-auricular nodes, your AB nodes, your bundles of hairs, your propensity fibers, this you could now relate to. Because you know what you're looking for and what you're looking at. And you know that certain things like certain electrolytes can depress an ST segment, but all this ST segment does, that's when the ventricles is what?
Relax.
Relaxing. Right. But because it's so powerful, you still get a little wave higher than the others. All right. Now look at the tree that you were doing just now. You didn't do this, the lying, but you did the sitting on there.
Standing.
And I do hope, guys, that you did the temporary to see the changes and how a person can move from normal to straight up to abnormal within a space of what?
Few minutes. Seconds actually.
So a person running from the road, you tell him what to do, sit down and relax.
To determine heart function under stress. Treatment focuses on determining the underlying cause. For example, it may involve changing medications or taking vitamin supplements like iron or vitamin B12 if the patient is anemic.
You need water?
Important lifestyle modifications for patients
All right.
include
You know what he said just now? Always look at what? Underlying cause. Everything underlying cause because it's from the creed. Okay?
Standing up slowly to allow negative feedback mechanisms to kick in when going from a supine position to stand.
Which is there?
It may also be helpful to sit on the edge of the bed. Doing so, contracting the calf muscles to increase blood return to the heart. If symptoms come while standing, contract thigh muscles.
Receptor.
Toes to contract the calf muscles. If you need to bend down to pick something up, don't bend down at the waist. Instead, squat by bending your knees. Using pillows to elevate the head while sleeping will decrease the chance of hypotension when you get up. It's important to avoid things or conditions that can cause too much vasodilation, such as drinking alcohol, intense exercise in or saunas. Be aware of what may lead to dehydration, including diaphoresis, lack of fluid intake, and vomiting or diarrhea. Support hose or abdominal support clothing can be used to keep blood from pooling in the legs and abdomen. These supporting garments should be taken off when lying down. It may be necessary for those that have a drop in blood pressure after meals to eat smaller meals.
Just before, some people like to, when you go to the bathroom, especially in this cold weather, you want to take what? A hot shower. And sometimes it feels so nice, you stay under the shower all the time, right? That is causing vasodilation. That's why I said avoid what? Saunas. Okay?
So the heat itself,
Like right now, it's very hot in here. I don't know if you guys have feel it. Right? That in itself can be a problem with hypotension. Okay? It's causing vasodilation right now.
Also, measures may be taken to increase vascular volume, such as increasing salt in the diet, but should be done in moderation.
All right. You hear what it said? Increase what?
salt in the diet,
So,
done in moderation.
but also, you want to be careful with that, especially if you are on antihypertensive medications. You just won't want to go using salt, because next thing you know, you have a rebound effect. Instead of just going down, it's going to go
Shoot up.
right up. No problem. Okay?
And with physician approval. Several medications may be used to treat orthostatic hypotension when lifestyle modifications are not possible or inadequate. Fludrocortisone or midodrine are used most often. Fludrocortisone is a mineralocorticoid that acts like aldosterone to help the body retain salt and water, thus increasing blood pressure. Midodrine is an alpha-1 agonist that causes vasoconstriction in arteries and veins. Droxidopa may be used to treat orthostatic hypotension due to certain neurodegenerative conditions, such as Parkinson's disease. Droxidopa acts as a
Dopa.
norepinephrine, and unlike norepinephrine, it can cross the blood-brain barrier. Less commonly used drugs include the following. Indomethacin is an NSAID that reduces vasodilation caused by prostaglandins. Phenylephrine and clonidine are both sympathomimetic drugs. Phenylephrine is an alpha-1 agonist, and clonidine increases sympathetic output to increase vascular resistance. Propranolol is a non-selective beta blocker, and its action on blocking beta-2 receptors in the vessels causes vasoconstriction. Pyridostigmine is an anticholinesterase medication that increases levels of acetylcholine in the ganglions of the baroreceptor pathway, making the pathway more active to resist orthostatic hypotension without worsening supine hypertension. Octreotide is a somatostatin analog that causes some vasoconstriction. Desmopressin nasal spray is a synthetic form of vasopressin that increases water retention and causes vasoconstriction.
All right. So, if you notice, look at everything that prevents OH, which is our
Yeah, but you're blocking those two
hypertension
words anyway.
on the right side.
Just go with
I
it.
suggest you just, if you got your phone, just take a quick. So you
Can you step to the side a little bit, please, sir?
So we can see it.
What's the blood pressure consider orthostatic? What blood pressure number is considered hypotension?
But my camera is not good. Somebody give me somebody buy me an iPhone.
Okay, on the person?
Once it causes vasodilation, because most of blood pressure medication causes vasodilation.
No, I'm saying what blood pressure number would be considered hypotension or, hypotension.
Oh, you mean the range?
Yeah, what range? What blood pressure?
Anytime you start going under 96, you start looking at hypertension. But especially so when you start affecting you and the person starts getting syncope,
Yeah.
lightheadedness. But you don't just say because a person with 96
Yeah.
about 6 days there. Like when you're like the cardiac type of thing,
Yeah.
right? It's only resting. But you have, I don't know,
Yes,
96 days is very good.
yeah. I see patient with that, that's why I wanted to know.
So you gotta be very careful with that. 96 is very normal for some people, especially athletes. Okay, and another question was asked about what would be a range for hypertension. You can say people who blood pressure is dropping under 90, systolic, you have a concern, right? But you do have patients who have 90-60, and it's very, very normal. In fact, most athletes, most of those big-time athletes, those ballerinas, they have low blood pressure, but it's different. Think about your digoxin. What digoxin does? What's the effect of digoxin? What's the effect of digoxin? We talked about digoxin, we did the AP call, right? So what's the effect of digoxin? It slows down the heart rate, but it increases the contractibility. It makes it pump harder. So you find these athletes, they don't want the heart to be what? Racing. Like when you go to the treadmill, your heart starts to do what?
Race.
But these persons who are athletic, their heart don't race. It increases what? The forceful contraction.
Contractility.
So you find that you have athletes, 90-60, no problem. This guy, what is his name? Armstrong, the rider, who won all of those, what is it, the one in France? What do you call it?
Lance Armstrong.
What do you call that one?
Lance.
Lance Armstrong. He won all those ridings. On the Tour de France, that's it, right. But Lance Armstrong, he was like a prodigy. He would jump on top of that machine, you know, when they're testing we call the stress test. He could ride and ride and ride. I seem like nothing's going on, that he's just normal. Well, like me, you all blood pressure gone through the roof, or what? What have you? When we go from 80 to 190 or whatever, but he's just there, and he just keep going and going and going. And that doesn't due to the drugs. The drugs is another story. He took drugs, but that his condition, right, might be used for endurance or what have you. But as an athlete, he has that contractibility of his heart and slowing down. Okay?
What was his condition then?
Right, and you find a lot of people have that strong heart, as you put it. People who exercise a lot, people who work out a lot, they have that. I'm not talking about the persons who go and work out today, then work out next 2 months. We're talking about people who work out every single day. year in, year out. Right? Because that's what those athletes do. Let's finish off this tape.
You have more gum?
To summarize, orthostatic hypotension is the low blood pressure resulting from inadequate blood in the brain that can bring about syncope.
Thank you.
There are many potential causes, including conditions that cause hypovolemia, heart conditions, hypothyroidism, Addison's disease, and diabetes mellitus. It's also a side effect of many medications, especially those used for hypertension and angina. Advancing age and mobilization and nervous system complications also increase the risk. Treatment measures include addressing the underlying cause, making lifestyle modifications, and in some cases, using medications.
All right, guys.
Thanks for watching.
Thank you. I got a question, real quick. Is this who's the creator of this video? Who is it? What YouTube channel?
Let me right here.
Down there.
It's on YouTube. YouTube.watch scale something.
No,
Let me.
Just put
the channel.
orthostatic hypertension on YouTube and then they'll give it to you.
Thank you.
And this one particularly, let me come out of this. I went into postural. And in postural, you see it came up as one of those. And I selected it. Look over here.
Yeah.
I just selected from all of these that was there. When
Okay.
I select it, it comes over there, then you click on it, and it goes up to the show.
Thank you.
So you can click on any one of those. And then they come up, it depends upon what you're looking for, what you feel comfortable with viewing. But I told you guys that before, that for learning, and as an overview, that you use animated stuff. Like the cartoon. You have a tendency to
Postural
remember it
hypertension.
more than if you were to look at other stuff, other images
Thank you.
and videos.
You're the best. Thank you.
Always start with animated stuff first. After you get an idea of what it's all about, then you can go to those other videos. Alright.
The other one,
You're the best.
share it. He says share it.
Now, the last day, look at how you make decisions. And how you make decisions is based on something as critical thinking. But before you do the critical thinking, you have to come up with your data or facts. And we look at something called root cause analysis. Root cause analysis is very important because that's how you will get to the bottom of whatever. I'm sure some of you might have been reading, some of you might have looked at the graph on the root cause analysis.
Myself. You want me?
Let me give you a scenario. Will you tell me what you think would be the root cause analysis? A man was boxed or was punched by another man because the man was being abusive to a woman.
Because of a woman.
A man who was being abusive to a woman was punched by another man who is a woman's father.
The root cause?
What you think would be the root cause analysis?
The woman.
The woman. Bad decisions.
it goes to why.
Yeah, why?
So why are you saying that it's the woman?
Because he didn't just wake up one morning and punch her. He has showed her already that he has that capability.
No, I get it wrong.
You didn't take up the roots and everything.
Huh?
Because that's the father's daughter.
Oh!
The man was.
I thought I got the right answer.
And then our father punched him.
Okay, this is a scenario, okay? The man was abusing the woman. We don't even know who that man is.
No, but he was an abuser.
We don't even know who that man is. That could be a random man. That could be a cashier. That could be the bus driver.
Wasn't gonna get here.
You know what I'm saying?
Alright, so I'm gonna make it because he said something else. So that was one of the things you look at first, right? In the history taking, you wanna know what is the relationship between the what?
The man and the woman.
The man that was hit and the woman. Because you already know the relationship between the woman
And the father.
man
The
that was
father.
hit. That's a daughter and
Father.
So you have established that. Now let's give the man who got hit.
Identity.
Let's say that he is the woman's husband.
Oh, man. I'm on my business. Domestic violence.
Absolutely, domestic violence, but what's the root cause? What you're saying is a mind reader.
Yeah. With the man.
What is the root cause? Don't say,
The root cause of the woman. Yeah, yeah.
remember the root is where it started. To start him to do what he's doing. So what is the root cause? What is the root cause?
Anger management. Anger problem.
No, that's all right.
Anger problem.
Isn't it the punch?
Anger problem. Anger problem with a man's part.
And you're gonna have probable causes, right? And then you got a root cause. You got 100 probable causes. Like you guys give us some probable causes. The man's abusive.
What is the root cause?
Maybe he
The root cause will be why he punched.
Why he punched?
Why he punched. It's a root cause.
So why?
Saying he's abusive, established. He's abusive.
Why did the father punch him?
Why is he abusive?
Why did the father punch him?
Right? That caused the father.
He was definitely cheating.
But the father, and this is not where it's going to be the history. But the father punched him because he was being abusive to his daughter.
That's right. That's right. That's a root
What
cause.
else it could be?
That's the only one.
That's a root cause.
It could be that he's a man who don't like to see another man hit a woman.
That's the only one.
Okay, that's how my father died. Because he saw a man hitting a woman he didn't even know, and he went and...
Help?
No, he just... My father was a kind of tough guy.
Wants to be a...
He was like a street fighter, so he went and... Don't touch a woman, don't touch her, you're going to talk to me. So he turned his back and walked away, and the man hit him behind his head.
Oh, man.
And that caused his death.
What a coward.
Fractured skull. But
That was a coward move.
the man got boxed, one box. Don't you put your hand on my dad again. Ever, whatever you want to put it. But what is the root cause? Think about scenarios. Because what you're giving right now is probable cause. So you're not doing what you say history. Let's go a little more. History of the relationship? It could be many different things.
The root cause
I
would
want to
be...
hear what you guys are coming up with.
The root cause...
A lot of probable cause.
He's an alcoholic.
No, the root cause would be protection. I'm protecting my daughter from this man.
Root cause could be protecting your daughter from this man.
Because Good what? Okay, why?
Because she's been,
The root cause of the why did
she's in harm's way.
why didn't he turn the first?
Yeah, why?
That would be the root cause.
Because he's still
Abusive tendency.
You don't have no reason to be putting a hand on her.
I thought, yes, sir.
You know what I'm saying? So he's within his right to punch him. He punched him, right? He's within his right.
He knocked him out.
Yeah, he did what he had to do. You know?
So why?
That's a root cause, protecting my daughter. That's the only reason I can find.
Maybe he find the husband cheating on the daughter.
No, Mr. West think he was on the
Remember the root cause is not that he hit her. We know he hit her. The root cause is
Why?
but we know that he hit him. But the root cause will be
Why he hit him?
Hit him, because he hit my daughter.
Because he hit the daughter.
Did he hit him because he
Hit
hit?
the daughter.
He didn't say she hit his daughter. It was rough handling his daughter.
Was he being abusive?
Abusive.
Right?
Yeah.
Oh,
That's a good
maybe he
cause.
cheated on the daughter. Okay,
You
he
added
found
more
out.
to it. You added more to
I'm
it.
going to give some good suggestions. What I'm trying to get you to focus on is what caused all of this. It could be a situation where this guy owed this man money for way back, and the man took that opportunity to give him because he got money clear. So he used an opportunity to what?
So hit the daughter.
That's
What is the root cause? He owed him money. Alright? And that is getting to the bottom of it. That is what causes the hit. Not what happened with that. Because, and that's where it's going to come. The root cause is going to be based on when you do your history.
history taking.
Whatever the patient tells you, that is where you have to do the
History taking.
taking. So, you guys did good, right?
Thank you.
But remember, there's probable causes, and then there is the root cause. And the root cause could have 100 probable causes, but only one root cause. So now when you come up with your decision, it is based on that root cause.
Cause. Very good.
Sometimes you see things, and it's not what you're seeing. You have to dig deeper.
Perception.
You have to ask questions. That's what root cause analysis is about.
Maybe you should like that.
Alright? Could be many different things.
Ain't no woman that likes to be.
It could mean that the man went to tell the father something that he didn't like. Or tell the father's wife something that he saw somewhere. So the man decided, you know what?
Don't talk about my
You touch my heart, I'm going to beat you. And then he want to hit him because he going to tell his wife that's how he sees somewhere.
Or maybe she's a YouTuber, she's doing a prank.
To get to the root cause. Right? And you'll have probable causes. Now, let me very clear to you guys. Root cause analysis is a requirement when you do nursing.
The more I take this class, the more I feel like nurses are like detectives. You know, you gotta always investigate stuff a lot.
Absolutely.
That's pretty cool. I was going to be a part of the law.
You need your FBI.
Pretty cool. Thank you.
That is too much.
Not important.
Look at the diagram of the root cause analysis. Find a diagram in your mark.
Show me a diagram of root cause analysis in nursing.
This is used for everything. The war that is going on in Ukraine, root cause analysis. Those military leaders are doing root cause analysis. You as nurses, doing root cause analysis too. Select one that you information out to you. Select anyone, select any diagram. that you find comfortable looking at?
I found this on the web.
You got it? You got it? Just go to Google and search them. You got it, you got it.
Oh, this is just if you look over here, what it says. What is root cause analysis in nursing? Root cause analysis is a structured method used to analyze serious adverse events. Initially developed to analyze industrial accidents, RCA is now widely deployed as an error analysis tool in healthcare. It's just like your S-bar that you're using now. S-bar was developed in the Navy. And then healthcare took it over. Same thing with
Root cause analysis.
root cause analysis. It's in another industry and healthcare took it over. Right? Because they find that it's good for
Helpful.
the patients and good for you as nurses. Alright?
Really, it helps you see math when you from the Pythagorean theorem to the area of the circle.
You don't tell me how to do something.
Really gets you hands on help even by doing.
Now hit the X on the top.
As soon as you put these things, you start learning interactively, I'm even ask you for something. Learn problem solving.
Berlin.org. Interesting.
What's gonna happen? If I here, let's see.
This is a lecture by Hiroko Lemi, narrated by Ungin Butar. This is the first of 2 lectures on root cause analysis. Root cause analysis, according to the Joint Commission on Accreditation of Healthcare Organizations, is a process for identifying the basic or causal...
You guys all know what JCO, right?
No.
Joint Commission.
The occurrence or possible occurrence
What is that?
of a technical event. Technical events include medication errors, patient suicide, procedure complications, wrong site surgery, treatment delay, restraint death, elopement death, assault, or rape.
All right. He's talking about sentinel events. Remember we spoke about sentinel events?
Yes.
He said that anything that can cause harm to a patient, and in nursing I give you 4, which is what? Decreased ulcers, fecal impaction, dehydration, and
Weight loss.
unplanned
weight loss.
Okay? So sentinel event is a major event event, and he gave you a couple examples just now. I want to talk about root cause analysis.
And infant abduction. The purpose of root cause analysis is to go beyond direct and somewhat apparent causes and figure out the underlying reasons for the event. The objective is to force one to think harder about the source of the problem. For example, it is possible that the label was not checked against the armband because the label was missing. Furthermore, it is also possible that the label was missing because the computer was not printing. Then, the root cause is computer malfunction, and the direct cause is the failure to check the label against the armband. Escorting employees to check the armband against the label is a waste of time, if there is no label to check in the first place. A focus on direct causes may prevent the sentinel event for a while, but sooner or later, the root cause will lead to a sentinel event. We use a set of techniques that have been developed for analysis of Bayesian causal networks to validate root cause analysis. A Bayesian causal network is a mathematical model of the cause and effect relationships and the way that these relationships lead to observed statistical patterns of an event. It consists of a set of nodes, typically pictured as ovals, connected by directed arcs. Each node represents a mutually exclusive and collectively exhaustive set of possible events. For example, Figure 1 shows a Bayesian network with two nodes. The node armband legibility
Alright, because I know you guys were going to mix up here. Confused.
are no armband. A node with two possible values is called a binary.
Let me come out to this because this is going to really throw you guys off unless you go a little more deeper. Alright? Because he talked a lot about mathematical calculations and all that sort of stuff. So let's go there.
So it's confusing me.
Don't want you guys to have problems.
I don't like being confused.
And I was trying to see one that you can like this.
Binary nodes are common in root cause analysis. Bayesian networks can also represent indirect causal relationships through the concept of conditional independence. Conditional independencies are
Alright. What I want you guys to do at home, I want you to fill up any one of the graphs. Not the graph with the calculations and what have you. But fill up the graph that will say the problem, then to give you another row with an arrow positive and give you probable causes. Like this just now, he looked at what? He looked at HIV, right?
Yeah.
So look at what can be probable causes. We have scenarios such as a patient, I think that's what we did last week. A patient nearly received what? What did the patient really receive last week? Let me get it.
Blood transfusion.
Transfusion. And what was the probable cause? Nurse who normally gave it was off that day. And then you had what? A new nurse. And the new nurse did not check what? The levels. So the concern was what? The nurse not checking.
The blood type.
So that's how you do your root cause analysis.
Analysis.
Right? How you come up with those answers.
Electric draw.
Any questions, guys? Alright, it's very hot in here, and I'm going to say thank you guys. See you next week. Next week, tomorrow. It's hot. It's hot.
Guys, vacation tomorrow?
And we call it all for the
Yeah, we coming tomorrow.
Unfortunately.
You barely couldn't even do a tennis today. You barely won. You didn't even do a tennis today. Yo, we gotta make sure we come for the day you're here at least. Sure. My dude is bugging.
I know he know I was here. I know that much when I was here. My opinion. tomorrow? Yep. All right, go home safe.
Team.